we are excited to be part of your program. I have the esteemed honor of being able to introduce you all to this wonderful panel today. I'm going to start with Rose Sheehan. Rosemary Sheehan leads system-wide people strategy, talent acquisition, organizational development, and HR operations at Hartford Healthcare. And if you live in this state, you drive around this state, you can't go too far without seeing the Hartford Healthcare name around. Hartford Healthcare is Connecticut's most comprehensive healthcare network and second largest private employer. She also leads the enterprise approach to AI adoption and workforce transformation. Prior to Hartford Healthcare, she served as CHRO for Mass General Brigham, 12 hospitals, 82,000 employees. She holds a BA in chemistry from Assumption University and an MBA from Babson College. Welcome, Rose. Next, we have Manojit Mo. We'll call him Mo today. Sarkar. Manojit Mo is the Vice President Healthcare Practice for Deloitte Consulting. Mo brings 28 years of consulting experience serving more than 50 clients across the U.S., including in Connecticut and New England. He completed management education at Cornell University and is an alum of the Global Healthcare Leadership Program at Harvard Medical School. He is passionate about advancing health equity, reducing cost of care, and improving healthcare workforce well-being. Mo, welcome. And then we have Nicole Feeney. She is the Senior Director of the Integrated Center at Oak Hill. Nicole leads Oak Hill's Integrated Center in Hartford, Connecticut, affiliated with Easter Seals, offering outpatient mental health services, augmentative and alternative communication, assistive technology, relationship and sexuality education, durable medical equipment reuse, and blindness services for individuals with disabilities. Nicole, welcome. And thank you all for joining us today. I am sure it will be an enlightening conversation. But we're going to start with a question for all of our panelists. We're going to start with Rose. So we want to hear a little bit about how healthcare is such an important driver of economic development in Connecticut. So tell us about that. What is it looking like right now?
Andrea, thank you so much. And I'm so pleased to be here. This is a wonderful panel and we're excited to participate. I think healthcare is an incredible economic driver, and it's on a number of different fronts. Obviously, it provides healthcare to the state of Connecticut, which keeps our residents healthy and ensures that they can continue to be terrific participants of Connecticut. But in addition to that, we create jobs. But we are anchor institutions in the communities in which our hospitals sit. And so we actually have a triple aim in that aspect. We create jobs inside the organization. We create jobs through our supply chain in our purchasing, and we create jobs as employees spend in the local economy. So it is much bigger than just the actual jobs that work inside of a healthcare system. And we're innovating in ways that one couldn't have imagined that healthcare would be innovating. And I think that that's one of the things that we can do in the state of Connecticut is create more partnerships and innovate more significantly, which really allows us to become an even bigger economic driver.
Wonderful. Thank you for that. Mo, I'm going to invite your voice here. Give us a little bit more on this.
Thanks, Andrea. And like Rose, I'm very happy to be part of this discussion. It's an esteemed panel and great to have you all here. I believe that healthcare already plays an economic development scale in Connecticut. It is a major employer, as Rose mentioned, and before that, Tiffany also touched on, a major payroll engine, which is very important, and a major source for statewide economic activity. We touched on the point that it drives about 250,000 workers, which is 1 in every 8 workforce that is there in Connecticut. It is a significant volume. Allow me to go a little macro on this. If you look at the overall US spent on healthcare, it is 18% of our GDP. It's like $10,000 per person across this country. So that's the volume that we are talking about. If we think about the chronic disease that is there, 133 million people in this country are going through a chronic disease, which is one in every three. So I don't want to put it as an opportunity, but that's the positioning of Connecticut, where we have this connected ecosystem of health systems, insurers, scientists, and labs, and of course professional services like us to serve this population. It's a huge opportunity.
Wonderful. Thank you for that perspective and sort of lifting us up a little bit more to kind of think of it more globally. Nicole, what would you add to this?
Well, I'd like to thank everyone for having me as well. I'm excited to be here. I think, what I'm contributing to the conversation too might be a little bit unique in that I'm coming from the disability services sector. And so to add to a little bit of what Mo was saying, and expand on that a little bit is we're seeing the aging population across Connecticut increase, especially for those with disabilities. We're seeing an increased number of people with disabilities who are aging and have unique needs that we're not necessarily entirely prepared to serve. We're seeing rising rates of chronic conditions, like Mo was suggesting, including mental health conditions, dementia, and so much more. We're also seeing significant staffing shortages that are having a direct impact on the increase in demand for those services and the support systems of the people who are impacted. From our perspective at Oak Hills Integrated Center, our work highlights how some of those traditional healthcare and uniquely designed disability services can be brought together to enable economic growth while also promoting a holistic, person-centered approach to care. When we provide services to individuals with disabilities and their support systems, we are intentionally reviewing their profile, carefully listening to the identified needs. But something we're trying to do is also listen for unmet needs, things they didn't know existed, to help be proactive in their service and their care. Services like smart home technology, assistive technology, communication technology, reused durable medical equipment, and coordinated mental health care services. Services like these, like the ones we're providing and other community providers offer, help people live more independently with autonomy, remain in their homes, in their communities, and help them engage in the community, also in the workforce. So getting people back to employment beyond what they think, I think what they think is possible. So at the same time, we're addressing all of these needs. We're also trying to take a proactive approach and reduce the strain on higher cost systems like emergency departments and hospitals.
That is quite an area that we could probably have a whole separate conversation about. So thank you for that perspective. So let's kind of continue on that, Mo, and I'm going to go back to you because you started talking about a little bit higher level. When you think about trends you're seeing nationally in healthcare investment and transformation, how is Connecticut comparing? Especially thinking about some of the things that Nicole just mentioned.
Yeah, so I don't know if I would be able to compare Connecticut per se. Please allow me to
Yeah.
not do that in that way, but let us look at what is going on. We have to think macro. The one line statement is the future of health is going to be organized around the consumer. That reality, that patient-centric approach had been discussed over a period of time, but it is a reality now. We are at that inflection point of a hockey stick when it is going to be reality. The patients and the consumers are getting empowered. It's going to be centered around them. And when we talk about that aspect, coming down one layer, what are the drivers? What are the help or what are the technology changes that are going to drive it? The few thing that comes to my mind first is like AR. Using AR, VR for all sorts of capabilities is here and is going to be deployed. Is connected with the 5G or the connectivity that is getting into rural areas now. AR, VR with the mobile dispensary and the mobile clinics using 5G is going to be here. Biomedical engineering is going to be a transformational exercise right now, meaning it's not. I don't think I can overemphasize on this point. I think in a period of, let's say, 10 years, maybe we would see cancer and diabetes as a defeated disease like polio. And when we think about that, those sort of a journey is going to be driven by biomedical engineering. It's very important to note that.
Yeah.
The last point on those technology aspect is quantum computing.
Mm.
It is not going to only change the future of healthcare, it is going to change the business model of healthcare. Again, driving that perspective of consumer at the center is what is going to happen. I'm going to finish this talk, this particular point, that while we are getting to this journey of a period of 5 to 10 years, there are a few things that the leaders need to do right now, and for that reason, they're focusing on it. First is when you make the consumer at the center, you got to drive trust. How do you drive trust? You got to give them right sort of data privacy and security. So that's the first point that all the leaders are talking about. And it is connected with GenAI and AI, which is nothing but data and curating data appropriately. The second thing that is going to happen is a care delivery transformation. How do you deliver care? Where do you deliver care? How do you bring healthcare to the consumer's doorstep compared to the consumer coming to you? That's the second thing. And third, which Nicole kind of touched, the workforce challenge is going to be transformed using these techs. I mean, it's going to be a hybrid workforce going forward in a period of time. So these are the broad level trends that we are seeing. And it's a very, very important point where Google and Apple and Amazon are also contributing to it. Yeah.
Yeah, that's fantastic. Rose, is there anything you would add to what Mo just shared?
Yeah, I think what Mo just shared, let me just make sure. Yeah, what Mo just shared is exactly what we're focused on. So those three areas, trust, care delivery, and the hybrid workforce. In terms of trust, I mean, one of the key aspects of delivering appropriate healthcare is to provide it in a way that our patients believe that they're being cared for the way they want to be cared for. And so Hartford Healthcare has the aspiration to be the nation's most consumer-centric healthcare system. And that means first delivering on a frictionless process of care, because care is not just coming to a hospital or coming to an emergency department. We actually believe this is the best time to be in healthcare. It's the time where we can actually transform most quickly than we ever could. We have the tools and technology available that allow us to transform it. And that's why we've been so focused on not just delivering care close to our consumers within 10 miles of everyone's home, but actually in the palm of their hands. And so we have our Hartford Healthcare HHC 24/7, which provides care to patients in the palm of their hands in virtual care. And that's what Mo was speaking to, a hybrid approach to providing care, and quite frankly, a hybrid workforce, because those physicians and providers are no longer actually in an office setting. They're actually providing care from their home, perhaps, to a patient in their home 24/7. We really believe that we have to double down in providing care in the home. And the reason is because that's where it's most affordably provided. And so one of the things that we've just launched is a remote monitoring partnership with a company called Cadence. It's an AI-driven company, and it allows us, and we've already launched, we just launched this about 2.5, 3 weeks ago, and we have over 800 patients already with home monitors for high blood pressure and for other areas of concern, congestive heart failure, diabetes patients, hypertensive patients, and we're already seeing a major impact. So instead of bringing those patients into an office setting, we actually are monitoring them 24/7. And that's the way to really ultimately lower the cost of care, provide care in a lower cost way, but in a more consumer-centric way. The feedback from our patients has been exceptional. And I think to Mo's point, this is where healthcare is going. AI provides us the tools and technology that allow us to really reimagine and reinvent healthcare.
Thank you.
I
Thank you
don't
for
know if
that.
this team, allow me, Andrea,
No,
I don't know if this cohort is aware. Hartford Healthcare is actually the first organization in the New England area to launch the AI Innovation Center. It's very important for us to note Yale, New Haven, had been launching some of the partnerships and the collaboration, which is very unusual. We have not seen these things across different other regions. It's a very, very exciting things to see. Yeah.
Yeah. Thank you. Yep.
Thank you. Great, thank you. So Nicole, sort of bringing this into your practice, can you talk to us a little bit about the importance of this integrated care model and community partnerships on improving healthcare outcomes?
Oh, sorry. Am I unmuted? Okay, perfect.
Okay.
Yeah, no. So, what we've seen is that no single system or organization can meet complex needs alone. We need each other. We need to be intentional. Providing that integrated care is really essential, especially for the people that we serve across Connecticut. But taking a proactive approach will always be the best approach for the people that we serve. Addressing needs in silos can leave individuals, families, support teams feeling incredibly isolated, confused, resentful. It can even lead to people giving up on the care that they need. We see it every day. So integrated care is about really connecting the dots and ensuring individuals' overall health and quality of life are being considered from a wide lens. But while you're in that wide lens, you're also coordinating care with them through traditional health-based services or community-based services, unique disability services, or just purely connecting people to resources across Connecticut that are outside the scope of, say, Oak Hills Integrated Center. We recognize we can't be the experts in all the areas, so we're actively looking for partners in the community who can also provide some of those additional areas of expertise. At the Integrated Center, we're seeing this play out every day. What we're trying to do is bring assistive technology, clinical expertise, blind services, speech and language pathology, and social supports while working with a lot of other state agencies, BESB, Bureau of Education Services for the Blind, DDS, group homes and other residential provider organizations, and individuals and their families to ensure that they're getting that individualized coordinated care. So those collaborations really allow us to identify the needs of individuals early on and then respond more effectively and kind of walk them through the process. So this approach is really part of the fabric of our model, but what it's doing is really reducing that fragmented, siloed care, improving communication across multidisciplinary team members and their care teams, and leading to early interventions, which we always say is the most important. If we can get to something early, it keeps people out of kind of the kind of circling the drain of all of the services that exist, ultimately resulting in those better health outcomes and individuals feeling proud of the care that they're receiving, increasing their own self-determination in what kind of care they get. And then also, and probably more importantly, really helping us with the sustainability of the resources that we have at our hands.
Thank you for that. So this all sounds like an amazing future at some point in the future, but we still are building it, right? And we need to build it. So Mo, I'm gonna jump to you a little bit. Talk to us a little bit about the work that you do in your organization about helping to build these healthcare ecosystems that are strong, that are going to attract businesses, talent, and investment into a region. So if you're thinking about all the work that's being done at Hartford Healthcare, or the work that needs to get done to continue to build these structures, what's needed to sort of attract investment and talent and businesses to build it?
Yeah, I think if I had to place three bets in Connecticut, right, and I think we touched on these points, uh, they would be aging in place care. Second is bioscience and medtech. And the third is behavioral health. So these three definitely are the three bets for me if I look at Connecticut and all. For all of these, the demand across all the regions in the United States and beyond the United States, in fact, in the European countries as well, the demands for right sort of innovation and workforce is huge. We project that uh, between 2024 to 34, let's say 10 years, the job opening for healthcare only is going to be about 2 million per year
Mm.
in the United States.
Wow.
Uh, I would like to bring in one state just for a comparison, quick view.
Okay.
If we look at North Carolina, uh,
Mm.
when they kind of attracted more life sciences jobs and life sciences innovation around 2019, the growth in that particular business model had been 23% compared to the prior growth of 9% per year. Since 2019, they had been growing there. The average wage has gone up to 121,000. Okay. So the reason I gave these particular points is that we got to focus that how come we can support a connected ecosystem where
Mhm.
we attract the talents from both direct, service providers, as well as talents from the back end who are going to do the infrastructure changes. The way we suggest our clients, look, at the end of the day, one of my mentors kind of mentioned, whenever an innovation happens, 5% is tech, 80% is people, 15% is culture. So people and culture are going to be focused, and Rose's job is going to be even more important as we get into this.
Excellent. Thank you. And a great segue to the next question for Rose. So thinking about this, how can healthcare organizations better collaborate with community organizations? Oh, I'm sorry. That is not my question for you. My question for you is, how is Hartford Healthcare helping to prepare and attract the
Mm,
workforce needed for the future of healthcare?
yeah. I mean, I think Mo is right. We are going to see some shortages, and we're trying to be very data driven and understand where those shortages might be based upon the age of our workforce and predicting retirements and exits from the system. But we have a comprehensive workforce strategy and a series of partnerships with every college and university in the state of Connecticut. And so I think nursing is a good example. We just yesterday had our largest new colleague orientation ever. And in that orientation, we had 450 people at the Oakdale in Wallingford. And in that audience was 174 nursing fellows. So these are rising seniors, nursing students who are coming to spend the summer with us. And we are hoping we can actually hire all of them at the end of the summer. And we're seeing that our pipeline investment, our relationships with the universities, that is really paying off, that kind of intentional partnership. We have the lowest vacancy rates for nurses that we've had in many, many years. We have the lowest turnover rates for nursing and across the entire organization. And we're seeing the average age of our nurses actually decline, which of course we need experienced nurses, especially in those really complex ICUs and in the ORs. But we have a lot of medical, surgical, and ambulatory settings where our new nurses really thrive and allow them to build a career long term. So we've invested in every workforce. And when we use data to get ahead of it, we actually prevent the shortages. Right now, unfortunately, we didn't foresee the shortages in radiology. And I think across the state, we're seeing significant talent shortages with all radiology technologist roles. And so we're now working with schools to reopen programs, to expand programs, so that we can bring more people through the pipeline. But the key is to be proactive and intentional and not reactive. So we're actually looking forward 3 to 5 to 7 years out and identifying where we may see shortages and trying to plan ahead. But we can't do it alone. We have tremendous partnerships with our universities. They have been incredible in helping us to identify students and then educate them. We do the clinical placements and then we hire them. And it's been a really wonderful process. So our workforce is actually more stable than it's been in many, many years. And I just attribute that to a real significant portfolio of programs that we've been able to execute over the last several years.
That's fantastic. I was really quite astounded to hear that some of our area colleges graduate 10 to 12 people out of some of these fields. And I was thinking that seems like a very small number. And so it was really great to hear the partnership that you're creating with many of the area colleges. So Nicole, I was starting this question, but this was the question for you is to just thinking about collaboration with community organizations. How can healthcare organizations collaborate with CBOs and community-based organizations for everyone to think about addressing this long-term health and workforce challenge? What are your thoughts there?
Plenty of thoughts. If we want to really, I think, move the needle, partnerships between healthcare and community providers really need to evolve from, and I think we're working on this. I think everyone, can't speak for everyone, but I feel like this is the sense, is that we need to move from transactional to truly integrated care and really kind of partnering at that level, aligning ourselves around what some of those shared goals might be, whether it's improving the health outcomes for the individual or supporting their independence or autonomy, or increasing workforce participation, like Rose was talking about. We may have a need in some of those areas as well. Additionally, community providers need to be engaged in the process and early on when we can be, ideally at the point of care planning, rather than at discharge, and just kind of getting someone fresh out of the hospital with little to no information. Being part of the process is always very helpful. So when we're included up front, our supports can be more proactive, can keep people at home longer. It can be coordinated or tailored to meet their unique. Oftentimes for our folks, they're very unique and very specific needs. And probably most importantly is we need more sustainable funding models that recognize the value of the non-clinical services. So things like care coordination. It requires so much time and intention to make sure that people have everything that they need and they can be connected to those resources, but also services like assistive technology, smart home technology, communication technology. Some of those more unique services can strengthen people's ability to be at home longer, to engage in healthcare supports like telehealth. And so these ultimately provide the strongest outcomes and reduce overall system costs when they're done properly. But unfortunately, they don't really receive, I think, enough attention or funding, and often makes it hard for nonprofits or community providers to do that work well and be sustainable.
Thank you for that.
And Nicole, it's so essential so that we can keep people out of hospitals where the care is expensive and people who actually need to be in beds can't get into those beds because we can't get patients home safely. So such important work that you're doing.
Amazing. Thank you for that. And sort of building on that, Mo, thinking about what Rose and Nicole just shared, when you think about successful collaboration across healthcare, business, technology, and community, what does that look like? What does successful collaboration look like across?
Yeah, the first and foremost thing where we kind of struggle to bring in integrated healthcare, the data has to be flowing freely. It has to be in interoperable. We've got to trust the data, and that's a big thing to achieve. Okay, and that's where I think a significant amount of innovation that is going to come up, where I say like the data conveners, like who are going to collect the data, connect the data, and securely distribute. That is where I think a key action need to be done between professional services organizations and the federal and state as well. They have a very, very important role to play on this. Uh, I also would like to say that the well-being and care delivery that Nicole just touched on, there are significant amount of products that we expect from virtual care, home health care, community care. And just a data point, there are like 3 million new products that came over last year, out of which 100,000 products were actually in home, and about 100 products crossed like $1 billion revenue. So there are more and more such products that are going to come up, maybe integrated with the larger players. So that's what well-being and care delivery, where the collaboration is required. We got to talk more about it, be open about partnerships. And finally, the care enablement. care enablement is a big challenge in today's world. Like supply chain is still like age old. It's the reality is I order something on Amazon, I get it by the evening.
Right.
Supply chain is going to get there. It is going to be integrated. It is going to be like individualized. Like for me, what is the thing that is required and ready right on time? So that is where the collaboration is going to look like in the future, and it's not too far away, I think.
Good. I think we all are excited to hear about that. Rose, would you add anything to what Mo just said?
I would say what Hartford Healthcare has been focused on is identifying partners, technology partners who have really innovative solutions to help us really transform the way we've been doing work. So examples of that might be K Health, our partner in our 24/7 app. We now, with K Health, have launched our own personalized patient GPT connected to Epic, and I use it. I love it. I now, if I have a health question that may not rise to being able to, reach out or wanting to reach out to my physician, I can go on to Patient GPT and it connects to my health record so that it gives me intelligent information that's all interconnected with everything in Epic. So we have been identifying it, and Mo had mentioned this earlier. Dr. Barry Stein, who leads our Center for AI Innovation, has amazing eye for terrific partners. And so we have a comprehensive ecosystem of some of the world's best AI innovators. They are amazing companies like Abridge and ADOC. We have been able to partner with them to really not just transform the way care is delivered where it impacts the patient, but also where it impacts the colleague. So one of the ones that we're most excited about is the ambient listening tools that allow the physicians to actually now be face to face with the patient versus keep fingers on a keyboard looking away from the patient. The feedback we're getting from our patients is amazing, that I finally feel like I'm being listened to. The feedback from the physicians is incredible because now they're not going home at night and entering all of their notes. It's all captured through their AI ambient listening tool. So I think where healthcare needs to go, it cannot do this on its own. Healthcare does not have the time nor the money to invest to build these tools on its own. So where Connecticut can be really helpful, the state of Connecticut is really bring in these innovative entrepreneurs to showcase them to healthcare, to the healthcare ecosystem, helping us to solve the most difficult challenges in healthcare. And if we can do that even more than we're doing now, we're going to unlock tremendous capacity, our ability to deliver care more cost effectively in the way our consumers want it, and ultimately with highest quality and excellence. So we're super excited about the ability to innovate. It's like everything we talk about every day.
Love that. So I'm going to let you keep the floor, Rose, because hard to believe, but we're already at our last question before we take questions from our group that's assembled here. So when you think about just everything that you just shared and you think about, thinking down the road, what gives you the most optimism about the future of healthcare in Connecticut?
Yeah. First of all, we're the number one state in the country for quality. So that alone puts Connecticut above every other state in the country. So we are ranked number one as it relates to quality and safety. That is amazing. And so that's not just Hartford Healthcare, that's all of our hospitals that are raising the bar on quality in the state of Connecticut. So that makes me incredibly excited. And then I think what makes me really excited is the fact that we have an incredible workforce of dedicated people who do work so tirelessly to care for our patients. Every single type of workforce. We have both clinical and non-clinical people who work for us, and they're incredible. And they are also innovative, and they're coming up with ideas to make things better and more efficient. And then lastly, our partnerships with lots of incredible entrepreneurs. So as Jeff Flax likes to say, it's never been a better time to be in healthcare. And I truly believe that we have all the ingredients to truly transform healthcare.
Fantastic. Thank you for that. Nicole, this is our final question before we take questions. What are you most optimistic about?
I think from our lens in the disability sector, I think we too have just opened up an integrated center with a new care model and trying to provide services in a meaningful and impactful way that might be a little bit different than years past. And as I think the first integrated model truly in Connecticut, we're excited about the level of conversations we're having with hospitals, community partners, state agencies. Everyone does seem to be aligned on what we want for folks in healthcare. So it's really just a matter of time at the end of the day and being able to move the needle forward. But it does what feels exciting is that there does seem to be a lot of people who are on the same page with where we want healthcare to be. So it's just a matter of time before we can get there.
Excellent. Thank you for that. All right, Mo, what's making you excited? What are you optimistic about?
Oh, it's one of the most um, exciting time for Connecticut, I think. Look, Connecticut has the ingredients that many larger states want. Leading providers, strong academic research, and a real commercialization pathway with the insurers, and within a small geography. It's so connected. This sort of a discussion is not always possible in larger states. So this kind of a collaboration is critically important for the future of healthcare, and that is what is making me very excited about Connecticut.
Fantastic, fantastic. All right, so we're going to turn it over to, I think we have a few questions here. I saw them coming in a little bit here. Let me just get to. So let's starting at the top here. Let's see. Oh, Mo, you actually provided some responses. You want to talk about the first one? What are some of the challenges with turning these data into actionable insights? Is it integration across resources, platforms, analysis efforts, higher level communication of data? And I see you gave a response. Do you want to add to that?
No, I think it is happening. Next best action by the payers, providers like Hartford Healthcare is already getting there. And Nicole rightly mentioned about the topics that she mentioned about collaboration. It's already happening. Look, there are lots of data, but they're disparate. We have to
Yeah.
really make sense of that. We
Yes.
touched on Epic. There is so much of data that is there in EHR, in EMR. Uh, how do you really personalize it is going to be the future. Yeah. The challenge is, I think the most important challenge is the incentive, the misaligned incentives that are there. It has to be aligned. Incentives like my healthcare is paid by somebody like my employer, whose incentives are not always aligned to my journey of healthcare. These alignment need to happen. So once that alignment happens at a very emotional level, then the data is going to flow. It has a cultural aspect aligned to it.
Right. And there is a lot of data that's out there, and it's making sense of it and being
Yeah.
able to make it usable and actionable. I think it is going to be part of the current challenge for
Yeah.
sure. Great. We have a question here. Any thoughts on how healthcare professionals with new viable innovations can partner with hospitals?
To take that one. So
Go
we
for
we
it.
are always looking for people who have innovative ideas to solve difficult challenges in healthcare. So if someone on this meeting has anything that they'd like to share, they're more than welcome to email me directly, and I'd be happy to pass it on to Dr. Barry Stein. So I'm not sure if my email's available, but I can certainly put it in the chat.
Okay. Wonderful. I bet there's some folks here that have some ideas that they'd be happy to share with you. Before I turn it back over to Tiffany to sort of talk about what's coming up at the CHC and wrap us up, I wanted to just sort of run through some of the things that I heard. Right, we have to make sure that in what we're doing, we're driving trust overall. That's going to be an important part of whatever gets built and gets delivered, because if people don't believe in it or they think their data is being inappropriately used, they won't buy into it. They won't use the tool. So trust and many other aspects of trust, but that is a big one. We talked a lot about care delivery, right? We talked about the importance. It's interesting. I've been looking at Rose. I don't know if anyone else is. I've been looking at Rose, and I can see the future. I'm imagining it says the future of care is going to be people centric. centric.
That's
And
right. That's exactly what it says.
fantastic, fantastic. So, right. So thinking about that idea and how are we driving more people-centric care, right? I think about having been in a number of the hospitals and seeing, people in the hallway and, there are a lot of challenges, but I'm also seeing buildings getting erected, right? And creating more space. And I think to what Rose mentioned, this idea of we don't want people getting their care in the emergency room, right? There are better ways to get care, and how do we start creating these solutions overall? And then we talked a bit about the workforce and the changes that are going to be required in terms of the hybrid workforce and probably more of a 24/7 workforce. So I think it's very interesting that in 2026, we still can only really go to the doctor between, like 8 a.m. and 5 or 6 p.m. when we are sick 24 hours a day, right? We could potentially be, and sometimes our only answer is the ED, the emergency department. So I think that is going to be an important care. Thinking about the technology, we've talked about all the ways technology is going to emerge and ways that we can use it to keep people out of the ED and keep them home more and getting the care that they need instead of relying on these structures that have been made for really acute issues, right? So we really did cross a lot of different topics. I want to invite this group, the panelists here. Is there anything else that since we've been talking that you think that we need to mention that we haven't? Think we covered it?
I think we covered it.
All right, fantastic. Well, I want to thank you all for being here and offering all these amazing perspectives. And Tiffany, I'm going to pass it back to you.
Thank you.
Thank you all so much. What a great discussion and really great insights about where the future of healthcare in Connecticut can go. I do see a comment here made, which I do have a comment for. So Yvette said, Connecticut also has 4 of the top 10 health plans in the country, United Health Group, Cigna, CVS, Aetna. What is our perspective on aligning financials of healthcare with healthcare plans, delivering clinicians of care? Oftentimes people may not seek care because of the cost, even though that they have health insurance through their employer. And there is fragmentation. So I am proud to say that one of the unique things about the Health Council is that we do have payers part of our membership, and we're just beginning to have those conversations to bring together in our leadership, our payers, including Connecticut, United Health Group, and our providers, to say we're right here. And it started with building trust, as we talked about. We need to get to know each other and start discussing where the opportunities are, because we all live in this great state and we want to see our state thrive and we want to see our ecosystem thrive. So more to come regarding those conversations we're having. If you want to learn more, please reach out to me if you'd like to join the Health Council about ways we can engage. We also have upcoming Trend Talks, which is our virtual webinar series where we host talks and have the opportunity for people to learn about upcoming sessions. Our next one is coming up this month in partnership with CBIA. We'll be doing an end of legislative recap of all things focused on session for healthcare. And so we thank you all so much for your time today. You guys get 12 minutes back on your schedules, and we hope you enjoy the rest of your week. Thank you all, and thank you to our panelists.
Thank you, everyone.
Thanks, everyone.